Good afternoon, and thank you for joining us today. This is Ashley Politz, Executive Director for the Louisiana AAP. Today we'll be discussing Understanding ACEs, Building Self-Healing Communities. Dr. Eric Griggs will be our presenter.
Couple of things, just wanted to let all of you today know this webinar series has been made possible by a grant from the American Academy of Pediatrics and the National Center for Child Fatality Review and Prevention. Just in a couple of quick things to note, we are recording this. A link to the video as well as the slide deck will be shared with everyone who registered. We will also be sharing it on our YouTube channel. Keep that in mind, please be aware not to share any personal health information if you're talking about a case or a client. And we want you to participate. Everybody will have the ability to come off of mute. So make sure that you are muted, but when you want to ask a question, I'm certain you'll have the ability to chat. This program has been accredited for 1.0 AMA PRA Category 1 credits. We'll talk at the end of the training about how you obtain those. Disclosures, Dr. Eric Griggs, who's our presenter today, has no disclosures to make. Louisiana AAP Planning Committee member, Dr. Joseph Bocchini, has disclosed relationships, which you can see there on the screen. And now I will let Dr. Griggs take it over, and I'll go to your next slide, Dr. Griggs.
Thank you. You know, it's funny, as you can go back to that picture, that reminds me of when I had hair. Go figure. Wow. I didn't just lose it during COVID. Thank you for the introduction. I want to, first of all, put out a disclaimer. ACEs, or Adverse Childhood Experiences, there are parts of this discussion that could potentially be triggering, and I want to put that warning out there. The reason why has less to do with this presentation than was participating in a leadership retreat, and they had an exercise called the Race for Life. And I'm not sure if you're familiar with it, but it's one where you put everyone in the back of the room, or we're in the back of like a fenced-in yard. You stand on the fence, you take a step forward. If you had both parents in your house, take a step forward. If you never witnessed abuse, take a step forward. If your parents were educated, blah blah blah. Long or the short, by the time I looked up, I was standing at the back of the room on the fence. And then when they said go to finish the race for life, I mean, I didn't finish last, but I had to run harder. But it made me start thinking that my childhood was a lot worse than I had imagined. So it was a triggering moment. But then I thought about it, and as I think we all should. I said that and I recommended that whole exercise be flipped and be called a celebration of resilience. And that speaks directly to what we're talking about now: adverse childhood experiences. Next slide, please. And what we're going to try to do today is we're going to try to lead some discussions and talk about what they are, and what the effects that these adverse childhood experiences can have over the course of someone's life and on their lifespan. Who'd have thought that one of the largest public health discoveries could be attributed to the smallest of us, our kids? Next slide. So ACEs, it came from what was called the ACE study by Dr. Robert Anda and Dr. Vincent Felitti. I always say that wrong. Felitti. Vincent Felitti. It's the largest study of its kind, had over 17,000 patients in San Diego. I think it was a Kaiser study. It was done in the CDC and done in Georgia in the early 1990s. They're the co-principal investigators, and they've reviewed and approved all the information that we have for today. Next slide. So before we begin, there's some terms. Let's level set. We'll talk about the nervous system. Nervous system is what allows us to function, our senses, our perception, our movement, and it helps us by understanding these. It helps us understand why these adverse childhood experiences are so powerful and the effects can be so long lasting. The nervous system itself consists of the central nervous system, consists of the center or the brain, and then the spinal cord with the nerves going off of the side. They regulate our body functions. Each of the cells in the nervous system are called neurons, and they're like mini microchip computers that process and transmit information and allow us to adapt to ways to keep us alive. Next slide, please. Most of the wiring of our brain, and this kind of slide is kind of cool in the fact that something that you probably assumed, but it's amazing that life actually works that way, especially if you have kids, especially that have gone through puberty. Most of the wiring of our brains occurs as a result of our experiences, of our senses. And as you can see at birth, the neural complex or the network or the hardwiring, it doesn't seem to be that extensive. And that's because, when babies are first born, they only need the brain function, only need a few functions at that point in their lives. Fast forward to elementary age, like age 4 to 6 and to 11 or 12, that the kids, their experiences falling off their bike, finding out what's hot, what's not, making friends, the whole nine. You'll notice that the neural network or the network of nerves becomes more complex, and it's actually called arborization because it looks like trees, right? You can see those trees with the smaller branches falling off of them. Then, ironically, like my daughter at age 14, from being Pop's best friend to, hey, Pops, how you doing? To, you know what? I'm not talking today. Leave me alone. Strange things happen. Notice that there are fewer communications because what happens is with arborization, the branches or the networks that are least used tend to fall off, and it's called pruning that happens in puberty. It's a result of the neglect or not getting the experiences needed to nurture that brain. And again, if you've ever had a child that's hits puberty, you notice something different happens. Next slide, please. So this is an interesting slide. Every person's life is unique, but let's just, for the sake of this slide, let's just say there are two worlds, right? There's conception, there's childhood experience, adaptation, and adulthood. There's the bad path, as you can see. Up top, the stressful, toxic stress path, where there's danger, the full fight or freeze, and surviving the worst conditions, to the happy path, and the more benevolent path, the generous path, the safety. There's people, there's relationships, people in process possibility, and surviving the best conditions and vulnerable in the worst. Humans we're only made to deal with stress for about 20 minutes at a time, long enough to prepare for fight or flight with the spikes in cortisol or epinephrine or high. So these experiences that continually cause stress, like childhood abuse, neglect, or even being in a war zone or a pandemic, have a huge impact on development. And under these circumstances, our bodies tend to prepare for life. As a child, our bodies tend to adapt, and you remember the arborization, to prepare for life in a dangerous world. So the stress hormones tend to affect and influence the wiring. They sculpt our brains so we're wired to be edgy, hot-tempered, hypervigilant, or being withdrawn or dissociated or numb. This is the path outlined at the very top, as you can see. And for example, people who have traumatic stress from conception to toddler years have a higher baselines of that cortisol that I was talking about. And as a result, these people can tend to have a short fuse, be very self-focused because they're always looking out for themselves, and have a different time shifting gears from emotions to problem solving. Because if there's more danger around the corner, they don't have much time to think about it. They always have to be ready. Now, on the downside is that when you have the stress hormones like cortisol and they hang around for long periods of time, they not only can be toxic to our brains and can increase our our predilection for insulin sensitivity or diabetes, insensitivity or diabetes, it can make it difficult for healthy brain cells to develop. And that's called the trauma or unpredictable or toxic stress. Boy, that was stressful just to get out. You're thinking about it. The little boy, you just want to hug him because he's like this. Like, man, it'll be okay. Let's talk about the bottom half, the benevolent path. The benevolent world path is more kind, easygoing, helpful, and free and of trauma and stress. A world that we would want all of our kids to grow up in. These people are more likely to develop a brain that's focused with the chemistry and wiring to be more flexible and relationship oriented. Next slide, please. This is an interesting slide. So now that we've shown you the two potential paths, let's think about it. What kind of situations, what kind of matches do you think might be good for someone that had the top path? You know, not everyone can choose their upbringing, but what type of people do you think might be good? They give you a big hint in the picture for people that are edgy, emotionally attached, or quick to act. You can put it in the chat. I'll start. What about fire people? What about soldiers? What about police? What about emergency medicine doctors? What about EMTs? One common belief is that in our society is that people whose experience takes them on the top path are maladaptive. An ER nurse, absolutely. And the ER nurses run the world in the world of the ER. Let me tell you, during COVID, I feel like a lot of folks are in this category. Absolutely. You know, what's funny is, you know, there's a term called PTSD. And there's also a term that it's little talked about right now called acute stress disorder. And with the cycling, and I won't go COVID, I promise not to go to COVID, but with the cycling of the COVID waves and the anxiety, I think we're all living in, a lot of us are living in that top pattern just because of the uncertainty. But, you know, there's a common belief that people that go on the top path are maladaptive. It's untrue. The brain, both pathways are adaptive, and our brains are adapting to both experiences. So those that are in those, we might be, that live through those experiences might be drawn to more of these type of jobs that highlight our strengths. Next slide, please. So adaptations versus expectation is in biology, collide with social expectation. That's when we run into trouble, right? Yeah, you can kind of see where this is going. A child that has adapted and grown up on that top pathway might not be the model student in a classroom where you want them, where they're always asked to sit still, to share, and cooperate. It'd be really painful experiences because what we, you know, to actually teach these kids that they can't be successful unless they're able to sit still, and that's absolutely not the case. This child would be actively taught skills to require them to succeed in this context and tell them that their upbringing is bad, when there's a role for everyone, if we can just acknowledge it. And that's the whole purpose of this presentation and what's called trauma-informed care, looking at things through a trauma-informed lens. Next slide, please. So I want to, before we go here, you know, experiences, let's go back. Adaptations. There we are. Uh-oh. There we
Can you go back another one?
No, you're good. No, you're good. It's me. Let's go. It was slide. There she is. Yep.
And Dr. Greggs, I'm sorry, this is Adrian. Could you increase your volume a little bit, please?
Sure. Can you hear me now? Is that better?
That's a little better, yeah.
7. Trying to make sure. Go back one slide, please, Ashley. I'm sorry. So we went there. All right, next slide. Yep. Okay, cool. So here at this slide, I want to take a closer look at one of the factors that determines the effects of maltreatment, and that's age. Why do you think the age of a person at the time would have a powerful effect? I think you know, it's kind of a rhetorical question, but if you think about it, the earlier the trauma, the earlier the more severe the long-term effects, and the most primitive development of the brain. A tiny baby doesn't need all those neural connections, hadn't had the experiences, but it doesn't need to write a test. Write a paper or do a math test. It just needs to eat, breathe, regulate body temperature, sleep, and try to connect with someone who will nurture her. So the parts of the brain that control the inner body functions and the ability to connect to a primary caregiver develop the earliest. So the brain regions that controls things like abstract thought, math, they aren't fully developed till later in childhood. And so it continues this magnificent dance of experience and adaptation, generating age-appropriate capacities for feeling, thinking, and responding to the world of that child. And as the brain develops, there are sensitive periods for each brain region when the size and function and abilities of the brain are most affected by vulnerable toxic stress. New abilities build on our growth and development in the earlier months and years, and over time, that's when the arborization or the elaborate systems that help us increasingly navigate the complex environment. So think about this: if you have more of those toxic stress environments, and you're not able to develop as fully those complex parts of the brain for the emotional connections, the thought, the cognitive things like math and writing, it can affect the course of your life. Next slide. So stress interpretations in early childhood. We talked about it again. We talked about you can see at birth, it's a skeleton type neural system versus your elementary age versus your adult. The set points, what happens is you're setting the tone for how that child might adapt to stress. By the time we reach our mid-20s, our central nervous system, or the brain command center, it orchestrates everything from autonomic function, like the heartbeat and breathing, to complex goal behavior. And our brains determine what sensory information should be filtered out for our survival. Sorry. And our emotional responses. So again, the way we start is the way we develop, and the way that we respond to the world around us. Next slide, please. Executive skills. Everyone has. Where we are. We develop our early executive skills early in life. Response inhibition, working memory, flexible thinking, they use those in our day-to-day interactions. And we have there are games that require us to remember a series of steps to develop our working memory. Learning helps to practice these response inhibitions, sitting still, paying attention, things that we require our kids to do in class. And we continue to develop these executive skills into the third decade of our lives. And we all need them to achieve our challenging goals, succeed, quote unquote, succeed in life, and carefully sequence actions. These mental skills are coordinated in the brain's frontal lobe and involve many other regions. But there are multiple sensitive periods when developing executive skills, and we can improve them through practice. Again, everyone has strengths and weaknesses in executive skills, and it's normal to experience executive skill dysfunction in stressful times. Again, the hormones that regulate our stress, the main two hormones are cortisol and epinephrine. Epinephrine raises our blood pressure and prepares us to be ready to fight, flight, or hide. Cortisol does a number of things, raises blood sugar, but cortisol also simplifies your decision-making processes. Like, if you've ever been stressed out to the point where you can't think or you can't remember your name because you're in a stressful situation. It's like if your working memory, and we talked about these executive skills, is challenged, you're stressed, you might be able to explain why you should be able to take careful notes when you're stressed, so you can go back to it, if that makes sense. Next slide, please. We have a collective choice. We can actively develop the skills and accommodations that enable everyone to contribute. Everyone has a different learning style. Everyone comes from a different background. We can actively develop accommodations for everyone so that they can learn and adapt and contribute to the community, or we can continue to develop the social patterns of rejecting people when they have normal adaptive responses to their childhood adversity. So if you remember only one thing from this information about brain development, I hope it's that toxic stress can be hardwired into biology. So before we assume that someone's intelligence or rebelliousness is tied to a choice of quote unquote bad behavior, when you think about the possibility that the adversity might be at the heart of what they see. And a real world example, I have a sister that's 14 years younger than I am, and she went through a period when she was 6, 7, 8 years old where she was just getting in trouble all the time because there was no such lens at which to look at. I pulled it to the side. I'm like, what's going on? Well, the teachers tell me I'm bad, so I'm going to be bad. Kids respond to adults. Kids tend to want to please the adults. They want to be accepted. So we need to be careful and understand everyone's environment is different, and give grace as and consider these ACEs that we'll continue to discuss. Next slide. What was the ACE study? So we've been talking about the effects of toxic stress, and now we're going to switch gears and talk about the effects of toxic stress on the population as a whole. And this is where we'll look at the field of epidemiology. I think we've heard from a lot of epidemiologists over the last few months. Epidemiologists, they study the origins of disease, disability, population health, and productivity in a population. We're going to talk about the epidemiologic study, the ACE study, Adverse Childhood Experience Study. Next slide. So the ACE study, again, it was most of the prior studies, of health and social effects of childhood abuse focused on a single type of adversity, like sexual abuse. The ACE study broadened the picture to include multiple types of childhood stressors, and it measured a wide array of health and social problems. That's how it was so important to contribute to our public knowledge and public health with regards to ACE. It's unique because it provided a potential to understand how multiple forms of childhood stressors can affect a lot of the public health problems we're seeing today. The design started in 1991. In 1994, they gave funding to the Department of Preventive Medicine in San Diego. Kaiser Health Insurance Plan had more than 17,000. I want you to pay attention to this. It was more than 17,000 adult members that did not come from an under-resourced background. And they gave them a survey about substance abuse, disease risk, and health behaviors, mental health. The study participants were well educated, and only 6% did not have a high school diploma, compared to 13% of the US population. They were predominantly white middle class who had some access to the best healthcare in the world. And they were followed to assess the relationship of ACEs and cause of death, and incidence of disease and healthcare, and use of prescription medication. Next slide. Wow, what did they find? They found that this slide shows the 10 categories of ACEs that were studied. The first was household dysfunction, to include substance abuse, parental separation, divorce, mental illness, violence to mother, incarcerated family. The next one is neglect, and that emotional and physical. And then there was out and out abuse, emotional, physical, and sexual. As you can see, the percentage on the slide, ACEs are common in the middle class and well-educated population. So I want to pause here. I want everyone to pay attention to the slide. Again, I don't want this to be triggering for anyone. But what's interesting is I had my 25-year class reunion from med school last month, and just started talking about, I have an issue with mental illness in my family that's unique to my family. And there's certain things that I've witnessed growing up, and everyone in the neighborhood witnessed growing up, and didn't think that there was a problem. Lo and behold, there are ACEs. And according, if I were to take the ACE survey, it would not be 0. I had an average of 4 to 6 ACEs that I thought was just normal. And that's why I said that race to life issues should be addressed. There are things called benevolent childhood experiences, which are good things that happen, that I think should be brought more to the forefront, because this is all a test of our resiliency. Next slide, please. Your ACE score is the number of ACEs in the different categories. And as you can see, because they're so highly interrelated, it didn't make sense to look at single categories of ACEs and how it influenced health and social problems. So what they did was Drs. Anda and Dr. Politi developed the ACE score. It's just a simple count of categories of ACEs that each person had from 0 to 10. Each category counts as 1. So if a person experienced physical abuse, no matter how many times, that was a 1. If they experienced physical abuse and had a substance abusing parent, the score was 2. So I want you to think of the ACE score as a biologic stress dose. So as the score goes up, on average, the exposure to environmental effects of toxic stress also increases. And in this illustration, you can see that only about a third of people in the study, that's a third of the people, a third of the 17,000 studied had a score of 0. 16% had scores of 4 or more. So ACEs are common. They're nothing to be necessarily ashamed of. But they definitely this study defined them as a hidden burden in this study. Can you hear me now? Can you hear me now? Yes.
Yes.
As a hidden version in the study population, and if you extrapolate out to our population as a whole. I want to pause here because of my learning style. I want to pause for questions. I want everyone to take a deep breath. We're at 12:30, and I'd like to entertain any questions, maybe 2 or 3 questions in the chat that we can talk about up to this point. Again, I will try to stop early enough to entertain them all, but this is a lot of information to digest in a short period of time. And I'd like to hear the whistles and bells and cogs as they turn.
So Dr. Griggs, there are no questions in the chat, but if anybody wants to come off of mute, feel free to do so.
I'll take one that's in the chat right now, and then we'll plug on.
I don't see any specific questions, but I will say, can you talk a little bit about how this relates to, and you may be talking about this later, but the use of discipline in school settings? Actually, I did just get a question there. So if we're helping adult individuals in crisis, the crisis could be a result of long-term effect of ACEs. Is that correct? Can you go into a little bit about how that might manifest itself?
Yeah, so what's going to happen? Yeah, so it can manifest itself in a bunch of ways, and we'll get to it later. What this showed is the higher, what we'll get to, it's kind of flipping ahead. The higher the number of ACEs, the more ill effects it had on the person's trajectory to positive contributions to success. The higher the incidence of substance abuse, the higher the incidence of divorce, the higher alcohol abuse, violent behavior, all of this, it's a dose-dependent response. That's what I was going to get to. The higher the number of ACEs as a child and in early childhood, the more likely those things were to occur. So in looking at things from an ACE or a trauma-informed lens, it can help to, instead of judging that person or just keeping in mind the environment from which that person came, and helping through counseling and therapy, talking them through those things to address the root cause of those behaviors. And it can explain a lot of things. It can be very healing conversation in the right setting with the proper counseling, if that makes sense. Just like with children in the classroom, it's about the exact same. Instead of judging that child, thinking that they're a bad child, understanding that bad day, digging a little deeper to find out why and what's going on, why that child might be acting out. It's amazing how, we call it different things, but we as human beings over the course of our lifetime, we don't change our tantrums and our acting out behavior because of stressors. And if you know that person potentially had a traumatic beginning when it came to the development. Remember the firemen and the EMTs and the hypervigilant, wonderful ER nurses. A lot of times people don't take that positive path, but it doesn't mean that there's not necessarily hope. Does that help? So thank you. So I just want to reiterate that this is it's a stress, biologic dose-dependent response. It's like pressing the gas in the car. The more gas you put on your car, the higher it goes. Exactly, Tammy, that's beautiful. Yes, what happened to you? Asking what happened to you instead of not what's wrong with you. Because if you ask me, Doc, what's wrong with you? I'm be like, nothing, what's wrong with you? As opposed to what happened to you. I just had a bad day. Totally different conversation, right? It's how you say it, right? And we want to keep this in mind when we're dealing with adults and especially with our kids, where there's a higher dose of adverse childhood experiences. There's a higher percentage of people with health problems, and that's what I was getting to. Now, let me just say this, and again, this is the triggering part. If you ask me, I had an amazing childhood. I have an amazing, wonderful, and loving family. And that's my memory, and that's the memory of my family. That's the memory of everyone in my neighborhood. So I don't want people to judge their upbringing or go home and start a fight. Hey, mama, you know what? When you did no. We want you to just be reflective, and it's okay to, if you need to talk through some things yourself with a professional to help resolve and help you cope. So this is definitely not a judgment. What we're trying to do is we're trying to make it such that we open up our lens to be more accepting and grant more grace because of what's happened. Next slide, please. This is the dose-dependent response. And we're talking about the percentage of people with health conditions. So you can imagine this. Imagine swimming in stress soup from the time that you're born. The high epinephrine, the high cortisol, the hypervigilance, always being while you're developing your brain and all the other organs of your body. If you put it in that context, you can see the understanding of the more stresses you have early on, the more likely things can grow to dysfunction, or your coping or your adaptations can be unhealthy. So all the data from the slide today are formatted in the same way. I want you to know that the ACE score is going to be along the bottom, and the vertical axis is the percentage of people who have the disease or condition. So the first set of bars on the far left, you see the percent of people with become regular cigarette smokers by age 12, and you see it goes up as the ACE score goes up. Second set of bars, you see that the percentage of who were smokers as adults goes up in a stepwise fashion. So people with higher ACEs tend to have increased risk of, because they're smokers, right? They have increased risk of things like pulmonary disease or COPD. About 4% of the people with an ACE score, only about 4% of the people with ACE score of 0 developed COPD. So ACEs can lead to early onset smoking. You see how everything is related? It can lead to those other things. Next slide. And the reason we talk about smoking, ACEs can, they can reduce your depression and anxiety, and nicotine, or the actual, tell you, it's a bad story, it's a horrible story. After Katrina, a doctor that has no patients or no lab to do work is a dude without a job. So after Katrina, I decided I was going to try to be a contractor. I had contractor friends, and I figured that I was going to help people out by helping put their houses together. And I will honestly say, I apologize if I worked on your house and tried to hang sheetrock. Let me apologize now, because apparently that is not for me. I need to keep my day job. Over the course of several weeks, my job went from trying to hang and float in mud sheetrock to going to pick up nails and going to get lunch for everybody. Needless to say, part of the way that the contractors, the crew that I was with, dealt with the anxiety and stress of the post-Katrina situation was we go drink beer and smoke cigarettes. And I'm not a smoker. I developed a bronchitis and coughed up something that looked like something out of an alien movie, and had to take antibiotics for a long time. But the point is, and that was in my 30s. So you can imagine what would happen to a child that picks up the habit of smoking. Nicotine not only can reduce symptoms of depression and anxiety, it can also lead to a horrible smoking habit. Other 10 ACEs, which ones you feel pediatricians can most easily focus on and they practice as far as screening and reduction? It depends on the age of the child. You would look for the complaints of the parents, and those that you can't see, the unexplained emotional outbursts, the lack of being able to pay attention, the repetitive behaviors. There are a number of things that it's more of a conversation with the parents in a non-judgmental manner, and to find out what might be going on at home to stress the child. Dr. Charlie Zena, a pediatric psychiatrist here in New Orleans, world renowned, told us the story in the ECPLI fellowship of a young child, a little girl that wasn't able to express herself, but had witnessed as a child the abuse, domestic abuse between mom and dad, and mom left. So when she would play, she would have her dolls and everything be fine and be set up in order. And then all of a sudden the two dolls would boom, 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 and would fight, and everything would get destroyed. She was trying to express the trauma that she had witnessed and had seen, and there was a frustration in it. So it's something to reveal. Are there studies that reveal ACEs impact on children in utero or before age 1? There are all kinds of studies, and that's why on prenatal care, I'm not as versed in them, I'll honestly tell you, but there are definitely effects of toxic stress on moms as they're carrying a child. And actually, I can look for some of those to send you after this is done. Yeah, I was talking about the unpleasant emotion and cigarettes and how that can lead early on in life to other problems, and it can actually shorten lifespan. Next slide, please. The anxiety and depression. I want to go to, yes, ACEs can result, of course, in anxiety and depression. We talked about nicotine. Next slide. This one's an interesting one. Now that we can anticipate ACEs that are related to certain conditions, this slide shows the risk of becoming an alcoholic increases 6-fold on a score, from a score of 0 to a score of 6, from an ACE score of 0 to 6. So an ACE score of 0 to an ACE score of 6, the alcohol-related problems increase 6 times, and ACEs affect relationships with people. So people with higher ACE scores, interestingly, are more likely to marry an alcoholic. So just think for a minute how these ACEs can tend to be transmitted from one generation to the next. Next slide. ACEs and depression. Depression is it's the leading disability in developed countries. And here we see that the risk of depression increases for both men and women, again, in a dose-dependent fashion, a dose-response fashion, as the ACE scores go up. And ACEs are held in the body, leading to mental, physical, and behavioral problems in adulthood. And some of these problems are unintentionally passed on to the next generation. So becoming an alcoholic, marrying an alcoholic, suffering from depression can all be part of the intergenerational transmission of ACEs. Next slide. Here's a list of some of the health and social problems. And if you can think about it based on what we talked about, it logically makes sense. These are the list of the health and social problems that are in the documented by the ACE study publications. You can see that ACEs have a powerful impact on a lot of the health problems. We're living in a time with stunning potential for shifting the trajectory of health and well-being for generations to come. But the thing is, we have to look at it through a trauma-informed lens, and ACEs are a huge part of it. Are any of these surprising? I'd be interested to know. Kind of rhetorical, but kind of not. Next slide. We know that ACEs are common and they're highly interrelated. We know that they're cumulative act, and people with higher ACE scores are more likely to have multiple health problems. Discoveries about the effects of toxic stress on developing brain, what could provide the plausibility for the ACE study findings. So this information makes a strong case for connecting the ACE score to health problems as a cause and effect. Next slide. This is our pizza pie slide. So how do we put all this together to make a case for understanding ACEs as a powerful pathway to health and well-being? So now we understand that ACEs are common and they have a strong cumulative effect. Preventing ACEs and their intergenerational transmission is our challenge. In fact, the ACE study team and ACE Interface believe it's the greatest opportunity possibly of our time. This slide shows the percentage of various health and social issues that epidemiologists estimate are caused by ACEs. The calculation that's commonly used to do in public health is called population attributable risk. This is the oil spill. And you kind of see why it's called the oil spill. The percentage of a problem coded by the oil spill represents the percentage that's potentially preventable by preventing ACEs. It's quite large, actually. In fact, the high percentages on this chart are rarely seen in public health sides. The cumulative effect of ACEs, they show a powerful opportunity for prevention, no matter if you're working to prevent heart disease or cancer or improve a business, as well as aligning a portion of our work and common goal around preventing the accumulation of ACEs and moderating their effects. We can reduce all these problems all at once if we can look at this before I go, if we can look at this and use this to move forward to work on prevention. How do ACEs, Patrice asked a question, how do ACEs lead to unintended pregnancy? Risky behavior, putting yourself in dangerous situations. It's largely the risk taking. It's not only the risk taking, but it's the development of the brain. The less executive functioning portions of the brain can be less developed if the stress kicks in for the fight or flight, for higher thinking, if that makes sense. ACEs means adverse childhood experiences. Adverse meaning bad experiences that happen in a childhood. Does that help? Next slide, please. So this is the part where we can make a difference, right? The scientific research gives us the stuff that we can use every day, but the ACE studies, it gives a roadmap of it's not a detailed roadmap of services or programs, but it's something upon which we can build our services and programs. Next slide. And that's why we're here. helping to build these nurturing environments and nurturing programs and safe spaces. Again, safe spaces as adults. One thing I want to emphasize, and we're getting into our question time, but I really, really want to emphasize the fact that this is not something in third person. And that's what I want people to be careful to be triggered. Those same issues that a lot of us who have quote unquote succeeded and done well for ourselves in our family, those same issues might still be present, because just because you quote unquote succeeded doesn't necessarily mean that your coping mechanisms or the stressors that hit you in your family. You might have moved to a safer neighborhood, you might live there now, but your relationships with your family members might still be the same or have evolved to something more toxic, with the added stress of you being more stable. So it's a thing that's an ongoing thing. The important thing that I definitely want to get out is what the studies did show, and I hope it's in these other slides, it's later on, is that what they found is that all it takes to help change the trajectory of a child's life who has a higher ACE score is one individual, one adult being nurturing, one adult being protective, one adult creating a safe environment, and it changes the trajectory in a positive direction for a child that might be on a higher ACE score, ACE score trip towards something negative. It's just one adult, and that doesn't necessarily change. I like to put this in the context of when, I don't know if this happened to you, but when we were all growing up and our parents might make us mad, and you go outside, you call your best friend, or you go knock on their door and you go walk the neighborhood and you talk about all the things wrong with all adults in the entire world, and they say mine too, and then you walk and walk and walk, and by the time you get home, you're not mad anymore. Why? Because you're able to identify with one person, and one person showed that they cared. So that's just an FYI, and that's something I wanted to make sure that I put in here, that it's not too late. Again, this study was not done in an under-resourced community. It can happen. There's no space for judgment, self-judgment. You want to give yourself grace. You want to give your family grace, your environment grace, and you want to celebrate the resilience that you have to be where you are. That's the thing. So when people talk about ACEs, they often ask about resilience. People get excited about the notion of resilience, and in part that because it reminds us that our supportive actions actually matter. Our desire for resilience leads naturally for a search for a way to help others in other communities. So 3 protective mechanisms interact and guide adaptation. Those are our capabilities, attachment, and belonging with caring and competent people, and protective community, and faith and cultural processes. So again, we can create a more nurturing and caring environment to help improve relationships, and it makes a difference in anyone that might be on a negative trajectory. Next slide, please. Positive view. Wow, this slide makes me smile because you can see the smile, the positive and the hope in this kid's eyes. A positive view, it lets me know that I am important, I'm valuable. It helps me ask for help when I need it. Has anyone ever had a teacher in elementary school that changed the course of everything just by asking how your day is? You might have had a bad day, and they go sit in their classroom to calm down, and they ask, might be what's going on. It could be someone at church, could be someone in your family. One person makes a difference. And I'm not just talking about kids, because adults, we're older kids in the sense, but it's just one person. When we notice it, a positive view, it helps the story that we tell ourselves. We ask people throughout the pandemic, I was asking everyone to look in the mirror and give themselves grace, right? Forgive yourself for what's going on, forgive yourself for this, and it's grace, right? Good things it allows me to let good things happen to me. We can start taking notice of the gifts that each person has in ourselves and as others. So this is really, really a huggy, touchy-feely moment that really, really can be put into active practice when we start dealing with those around us. There are more slides, but I really want to stress, and we can go to 27, the next slide. attachment and belonging, because I just want you to see that picture. This is all about relationships, the acknowledgement and understanding that, you know, people care. And it's okay for you to care for yourself. As the slide said, relationships with caring, competent people are vital and contributors to resilience and recovery. Next slide, please. It's us as we learn. Oh, those crawfish look good. Yeah. Ashley, what was that book? Yes, crawdads, crawfish. Yes. As we learn more about ACEs, we're able to start building capacity, and we start nurturing and looking for other people with a common mindset to again take a trauma-informed and ACE-informed approach, not only to our children but to those around us, to understanding rather than saying what's wrong with you, as Tammy suggested earlier, asking what happened to you. And the next step is, can I help? Can I help in any way? Next slide. So this is where we talk about, and the purpose of having these discussions, these educational sessions, is when we talk about leadership expansion from different walks of life, with the same lens, coming together, shared learning, results-oriented decisions, so that we can work on improving improving the outlook and the outcomes in our society as we are today. Next slide, please. Lifting all beings, supporting healthy community processes that respect cultural traditions and values is a high leverage activity. Just as a rising tide lifts all boats, a high capacity community lifts all beings. People living in high capacity communities are less likely. Helping our neighbors allows for potentially less adverse experience scores, less drug and alcohol abuse, less depression, less serious and dependent mental illness, and fewer problems in work and school. Next slide. This change is up to us. It's shaped by our thoughts, our conversations, the way we relate to one another in relationships and families and in communities. Next slide. Thank you. I'd love to have your help in turning that race that I didn't like in being last in the race, to flipping around and helping change it to a celebration of resilience, so that instead of me being last in the class with my ACEs, myself and my army of people with ACEs will actually be first in the celebration of resilience. Thank you.
That was wonderful, Dr. Griggs, and you've got several kudos there in the chat. So thank you to everyone for joining us. Our next session will be June 23rd, same Zoom room. Quickly, if you want to take out your cell phone and scan that QR code, that will take you straight to the evaluation. I will also put the link in the chat box so that you can click on that directly. That is how you will be able to obtain your educational credits. And thank you again, Dr. Griggs. We really appreciate your time and this such valuable information.
Thank you all.